So, you've just been handed a prescription for amoxicillin, and maybe you're wondering, what exactly is this stuff? Well, you're not alone. It is one of the most common antibiotics out there, so today we're going to do a deep dive. We'll break down exactly what it is, how to take it the right way, and what to watch out for. Here's our game plan. First, we'll get to the bottom of what amoxicillin actually is. Then, we'll cover how to take it properly. We'll also talk about what to do if you miss a dose and some of the more serious signs to look out for. And finally, we'll touch on a few special considerations like pregnancy and other meds.
All right, let's jump right in. First things first, what in the world is amoxicillin, and what is it actually doing inside your body?
So at its heart, amoxicillin is a bacteria fighter. It's a proud member of the penicillin family, the antibiotics that pretty much revolutionized medicine. You might see it sold under names like Amoxil, but they all do the same thing: knock out bacterial infections.
And it's prescribed for a whole range of common problems. You know, that chest infection that just won't go away, a really painful ear infection, or that miserable sinus infection. It's even used to help treat stomach ulcers that are caused by a pesky bacteria called H. pylori. Okay, so how does it work? This is the cool part. It doesn't just, slow the bacteria down. It goes right for the kill. Basically, it stops bacteria from being able to build their own protective walls. And without those walls, they literally just fall apart. It's a pretty brilliant and direct way to get the job done. Knowing how it works is great, but making sure it can do its job effectively, well, that part's up to us. So let's talk about the right way to take it to get the best possible result. Think of these as the 3 golden rules. Number 1, space those doses out evenly. That keeps a constant bacteria-fighting level of the medicine in your system. Number 2, swallow the capsules whole with some water. Don't chew them, don't break them open. And number 3, and this one is so important, finish the entire course. I know it's tempting to stop when you start feeling better, but that's how the toughest bacteria survive and can come back even stronger. Here are a few more handy tips for you. Good news, you can take it with or without food, whatever works for you. If swallowing pills is a challenge, it also comes in a liquid form. But, and this is a big but, if you're using the liquid, you have to use the special syringe or spoon it comes with. Please, never use a regular teaspoon from your kitchen. It's just not accurate and you'll get the wrong dose.
Okay, let's tackle 2 of the biggest questions people have when they're taking antibiotics. Oh no, what if I forgot to take it? And what about side effects?
So you missed a dose. First thing, don't panic. If you remember pretty quickly, go ahead and take it. But if it's almost time for your next scheduled dose, just skip the one you missed and get back on track. The number 1 rule here is to never, and I mean never, take 2 doses at the same time to try and catch up. Now, what about feeling a bit off? Well, while side effects are possible, it's helpful to know that the really common ones, like feeling a bit sick or having diarrhea, only affect about 1 out of every 10 people. So for most people, it's a pretty smooth ride. And hey, if you do happen to be that 1 in 10, there are some really simple things you can do. Try sticking to simple meals, maybe avoid that super rich or spicy dish for a few days. Taking your pill after a meal or a small snack can also help. And of course, drink lots of water to stay hydrated. These little tweaks can make a big difference. Okay, we need to pause and talk about something really important now. While serious reactions are rare, it is absolutely crucial that you know the warning signs, the things that mean you need to get help and get it fast. And I want to emphasize that word, rare. A serious reaction is very unlikely. We're talking less than 1 in 1,000 cases, so the odds are definitely in your favor, but being prepared is just being smart. Now, something a little more common is an allergic reaction. This can happen to about 1 in 15 people who take a penicillin-type antibiotic. But the key thing to remember is that most of these reactions are pretty mild. And it is vital to know the difference. A mild reaction might just be an itchy skin rash, but a severe reaction, which is called anaphylaxis, is a true medical emergency. If you suddenly notice swelling in your lips, your face, your tongue, or you have any trouble breathing, you need to call for emergency help immediately. Don't hesitate. Besides a major allergic reaction, keep an eye out for these other urgent warning signs. We're talking about severe diarrhea, especially if it has blood in it, or any signs that could point to liver problems, things like pale-colored stools, dark pee, or yellowing of your skin or the whites of your eyes. If you see any of this, call your doctor right away. All right, to wrap things up, let's quickly cover a few special situations where you'll definitely want to have a chat with your doctor before starting on amoxicillin.
If you're pregnant or breastfeeding, the news is generally good. Amoxicillin is usually considered safe to take, and only a tiny amount actually gets into breast milk. But this is one of those times where you should always talk to your doctor first. It's just the safest path forward.
And this is another really big one. Amoxicillin doesn't exist in a bubble. It can interact with other medicines and even herbal supplements you might be taking. That's why being totally upfront with your doctor about everything you're taking is so critical for your safety. For instance, it can have interactions with drugs like methotrexate, the blood thinner warfarin, and even some other antibiotics. And look, this is not a complete list by any means. That's why it's so important to give your doctor the full picture of everything you're taking. And this all leads to a much bigger idea. Every single time you take a course of antibiotics correctly and finish it, you're doing more than just helping yourself get better. You're helping to protect one of the most powerful tools in modern medicine from becoming useless because of antibiotic resistance. So next time you get that prescription, remember, you're not just a patient, you're a guardian of our medical future.